Good morning or good afternoon, everyone. I'd like to welcome you all to today's webinar, Text Messaging for Hispanic Health, Smoking Cessation, and HPV Vaccination Reminder Services. We're right at the top of the hour, and maybe I'll wait just a minute or two more to begin, and so just hang tight and we'll start momentarily. Okay, once again, welcome to our webinar today, Text Messaging for Hispanic Health, Smoking Cessation, and HPV Vaccination Reminder Services. My name is Paul Baker. I am the Senior Director for Programs at the National Alliance for Hispanic Health, also known as the Alliance. The Alliance administers the Nuestras Voces, or Our Voices, National Hispanic Network to reduce tobacco-related and cancer health disparities. The Nuestras Voces network is actually one of 8 national organizations funded by CDC's Office on Smoking and Health and CDC's Division of Cancer Prevention and Control to operate national networks to serve specific populations experiencing tobacco and cancer-related disparities. One of the functions of our network is to facilitate relevant tobacco and cancer control-related webinars and other trainings for the public health community and other Hispanic-serving stakeholders to increase awareness and education on proven strategies and interventions like the ones we will hear about in today's presentation. If you haven't done so already, please go to our website, nuestrasvoces.org, and register as a member so you'll be sure to receive our updates and announcements. Just click on Join and fill in the registration form, and then look for a follow-up email to confirm your registration. Our network partners with 11 sub-network lead agencies around the U.S. that serve as regional network representatives and work with Hispanic-serving partners, organizations, and other stakeholders located in states within their regions. The network's main objective is to build Hispanic community infrastructure and increase regional and national partnerships to decrease exposure to secondhand tobacco smoke and increase smoking cessation, as well as increase cancer prevention and improve the quality of life for those living with cancer in the Hispanic community. So without further ado, I'd like to begin our webinar presentation today on using text message programs and campaigns to reach Hispanics and improve health, specifically in the areas of smoking cessation and increased uptake of the HPV vaccine for children. This webinar is intended to explain how these services can be used by organizations to engage, communicate with, and motivate people to take actions that will improve their health. Our guest presenter today is Dr. Kara Wiseman. Dr. Wiseman is a Cancer Prevention Fellow in the Tobacco Control Research Branch, which is in the Behavioral Research Program within the Division of Cancer Control and Population Sciences at the National Cancer Institute. Dr. Wiseman's research interests include behavioral epidemiology with a focus on the development, implementation, and evaluation of behavioral interventions for cancer prevention. Dr. Wiseman received her doctorate in epidemiology and MPH from Virginia Commonwealth University and a BA in biology from UVA. Today, Dr. Wiseman will talk with us about text message interventions for Hispanics and in particular the National Cancer Institute's Smoke-Free Español system. After she concludes, I'll provide a review of our network's HPV vaccination text message reminder system, which is a way for parents to ensure they remember to schedule the first and second doses of the vaccine for their children. So, Dr. Wiseman, thank you very much for being here today and sharing this valuable information with us. We'll switch over control now to you so you can share with us your presentation.
Great, I'm happy to be here and to present. Let me get everything ready. Can everyone see the beginning of the presentation? All right, good. Let's get started then. So thank you again for having me today. I'm excited to talk to you both a little bit about text message programs in general that are available to Hispanic and Latino smokers, and then, like Paul said, to focus in on what resources we have available at smokefree.gov. So just to make sure we are all on the same page, right now, Latinos represent about 55 million people in the U.S., which is 17% of the population. And this number is expected to grow to about 30% by 2060. So this is a very important segment of our population, and it's only going to become increasingly more important over time. So I think it's a very timely point for us to be talking about this group, and I'm happy to be here. So talking about their smoking status, for smoking, except for Asian adults, Hispanic adults have the lowest smoking prevalence in the U.S. However, this national data, it tends to lump all of the racial and ethnic groups into larger buckets. So among the Hispanics, it's second to Asians in lowest smoking prevalence, but there are some unique features even within Hispanic groups. For example, the prevalence of smoking is higher among Hispanic adults who were born in the U.S. compared to those who are born outside of the U.S. So that's important to keep in mind, some of these key differences. And there are some other differences within this subgroup. For example, among Hispanic and Latino smokers, they're more likely to be men, so there's a higher smoking prevalence among Hispanic men. And there are also differences by origin. So we can see that Puerto Ricans have the highest level of smoking, whereas Central and South Americans have the lowest prevalence of smoking. So it's important that we keep in mind these unique features. So even while we know the prevalence of smoking is lower among the Hispanic population, we also know that Hispanic smokers smoke less frequently. So you can see here, this chart shows daily smoking among U.S. adults, and we can see that Hispanics have the lowest prevalence of daily smoking. So they're lighter smokers. And these characteristics are important because our current clinical practice guidelines for treating tobacco dependence don't recommend medications like nicotine replacement therapy for cessation for people who are light or intermittent smokers. So that means that this group are most likely to be quitting without any medical assistance. Further, when you have a low prevalence of smoking in combination with lower access to care, that results in Hispanic smokers being less likely to be offered cessation counseling by a medical provider. That being said, even though they might not be getting offered as many cessation resources, there are still many Hispanic smokers who are interested in quitting and who need cessation resources and services. So that's where we think we can come in and play a role, specifically using mobile health. So what do I mean by mobile health? Mobile health, also called mHealth, is the use of technology to remotely track, respond to, or deliver an intervention for health-related events. Some examples include using a mobile-optimized website, a text messaging program, smartphone applications, or remote sensors. And mHealth has some real important potentials. One of the main things that mHealth can do as an intervention for platform for interventions is by increasing the reach that we can get to with our interventions. We can reach large audiences, and we can also reach underserved audiences, and I'll touch on that in a moment. And so one of the ways we can also use mHealth to help us is it reduces the burden of costs on the healthcare system. So you can imagine in the clinical setting, you might have smoking cessation counseling. That might be expensive and take a lot of time. If you can move some of the counseling or some of those cessation programs into an online platform or a mobile platform, that reduces the costs. and also reduces the time burden on the healthcare system. There's also real potential to increase engagement with these kinds of platforms. You can increase access to the intervention. If you think, for smoking cessation, if I'm having a craving, I can use an application or a text program on my smartphone to get assistance in real time, which I might not be able to get if I'm using a counselor or a physician to help me quit smoking. It can decrease barriers to participation by not having to schedule appointments. You can have everything on your phone. There's also less time between getting the treatment and implementing the behavior change strategy. And also you can improve potentially the intervention dose. People have their phones with them all the time, kind of at the ready. You can give them intervention content and material pretty much any time that they are willing to access it. So we really think that mHealth has some real clear potential benefits that can help with many different populations, but we think also in particular the Hispanic smokers. And so this is one of the reasons why we think that mHealth and cell phone intervention might be particularly beneficial for Hispanic smokers. And so we can see here on this chart, this is the latest Pew data that shows cell phone and smartphone usage in adults in the US. And so we can see that cell phone use is almost ubiquitous among everyone in the population. But it's particularly high when you look at race and ethnicity. The Hispanic adults are the highest coverage of cell phone use. And smartphone use is also pretty high, but not quite as high as cell phone use. So even though smartphones and apps can have some unique features and have maybe more potential for interactivity, since cell phone use is the one that's really highest, a text message program we think could have the largest potential reach. So that's what we focused on primarily. In preparation for my talk with you all today, I did a review of what text message programs are available for Latino or even just Spanish-speaking smokers, and there's really very limited evidence, and I think there's a couple of reasons why. So here's the currently available evidence. I found 2 published studies. The first study did not actually say if their intervention for Spanish-speaking adults was tailored in any way, but Spanish-speaking adults were eligible to participate. And the intervention showed a good effect, but there wasn't any stratification, so we don't know if the intervention worked better for the Spanish speakers versus English speakers. But taken together, it had a good effect. And then the second study was the only one I found published that looked at actually adapting a cultural adaptation of an existing English text program to a Spanish-speaking population. In this case, it took place in Argentina. However, this study was only the development of the program, so we don't have any evaluation data. And so when you think about the limited evidence, I think there's a couple reasons why we don't have as much evidence as we would maybe like. And the first is text message programs are, relatively new in the scheme of behavior change intervention, so there just aren't that many studies in general available for this platform to build our evidence base. But also, a lot of the programs in these text programs have been designed for heavier smokers. So when you think back to the general landscape of smoking among the Hispanic smokers, there aren't as many smokers in that subgroup who would be eligible for a lot of these studies. So that really leaves a lack of really good evidence. And that's also another reason why I think some of the smokefree.gov resources could be particularly useful, and we're helping add to some of that evidence base. So before I dive into our Spanish-speaking materials, I just want to give a brief overview of smokefree.gov in general. So smokefree.gov is a multi-platform, multi-behavior change intervention, and it's offered at the population level. It started in 2003 with a smoking cessation-focused website for adults, and it has grown and expanded since then. So you can see on this slide a little bit of a timeline of the smokefree.gov initiative and some of our major milestones in terms of web and content additions to the program. So we started with the adult program. We later added content specifically for women and pregnant smokers. Then we added teen content, and most recently we've added our Spanish language content, Smokefree Español. And each of these additions and growth has included web content, but also text message programs, as well as a couple of smartphone applications, which I'm not going to talk about today. So for the text message programs, our suite of programs started with the adult text messaging program in English. So that's our flagship program, and it's been the starting off point of all of our subsequent text message programs. So currently, we not only have the English cessation programs, we also have a text program for pregnant smokers, veterans, teens, teen smokers, and also smokeless tobacco users. In addition to our smoking cessation resources, we have some lifestyle modification programs now, one for weight management, changing your diet, and increasing your physical activity. For Hispanic smokers, in addition to the cessation program I'm going to talk about today, we also have a veteran program in Spanish. We also have the diet and physical activity programs translated into Spanish. So while I'm talking about cessation, we do have some other programs available if they would be of interest to you. So first I'll give an overview of our Spanish language website, which is how you get to the text messaging program. So this is the home page of our Smoke Free Espanol page, and the URL is at the bottom. And so this website was designed based on the existing smokefree.gov English website, and then it was translated into Spanish. And the translation process was, we did forward and back translation, and it was designed to have kind of a neutral dialect. And the website in general is supposed to be encouraging and a bit colloquial, and we tried really hard not to have a specific dialect come through, while that had some challenges. So in addition, the existing smokefree.gov website did not have special content on light and intermittent smokers, which, as I presented earlier, is a unique feature of Hispanic smokers. So this website does contain that tailored content to that group of smokers. This website gets about 30,000 visitors a month, and the top pages are usually pages about withdrawal symptoms, the rewards of quitting, our light and intermittent smoking page, and a page about creating a quit plan. And what's really encouraging about this website is we tend to have really high engagement, especially when you compare it to our general English language website. So the people who are accessing this site really are interested in our materials, which is great. Another interesting piece of information we looked at when we were doing some data analysis of our website is we have high volumes of sessions from this website are not only English speakers from the US, but from other Spanish-speaking countries like Spain, Mexico, and Argentina. They have some of the highest visits of the website. So we think we're filling an information gap both for Hispanic smokers in the US, but also Spanish-speaking smokers worldwide. So now we're going to drill in to focus on the main content of today's talk, which is our Spanish language text messaging program. So if you are on our website and interested in signing up, you click on the circled box right there, and that takes you to the sign up page. So our text message program, similar to the website, was based off of our English language text messaging program. So it's a text message program that's available to all adults. It's free in the US with an unlimited texting plan, and the messages that the user receives are timed around a quit date that is set by the user. We use an opt-in design, so you sign up if you want to be a participant or be a user. So you can sign up online using that link I showed you just a moment ago, or you can text ESP to a specific short code, which is for the program. And then if users decide they no longer want to receive our messages, they can opt out by texting stop to the program, and they no longer receive any messages. Now, they can re-sign up anytime they want to. It's not a one-time shot, but for any individual quit attempt, you can sign up and log off or opt out that way. So users get between 6 and 8 weeks of messages if they stay in the program the whole time, and there's variability because users get to choose their smoking cessation quit date. So when you sign up for the program, you can choose a quit date up to 2 weeks in the future of when you sign up. So that's why there's variability. So everyone gets 6 weeks of messages after they've started the quit attempt, but that 2 weeks before can be 2 weeks or shorter depending on the user's quit date that they set. The text program has a really unique bidirectional feature using 3 different keywords. So we have a keyword about craving, we have a keyword about mood, and we have a keyword about slip. So if a user is having a craving, is in a bad mood, or has slipped and smoked a cigarette, they can text each of these 3 words to the Smoke Free Text program, and they will immediately, in real time, get a message back that addresses each of these 3 items, depending on the keyword that they use. And I'll show you some example messages in just a few seconds. The other unique feature about our text message program using this bidirectional function is the program on regular intervals will text the user a question. We ask them about their smoking status and if they're still smoking at regular times, but we also ask them about their mood. We ask them about their craving levels and how they're doing. So it's designed to be a program that's not just messages to the user and that's it. It can be a bidirectional relationship. So here are some sample messages. The text program is framed. The messages we send are three general types of messages. We give tips to the user to help them stay smoke-free, skills kinds of tips, smoking cessation tips. We offer support, and then we also offer some facts. So all of the messages are designed to be encouraging and non-judgmental to help someone along their quit attempt. So the first example of a tip message, this one is talking about how it's very important to get rid of cigarettes and lighters. So this message would be sent right before the quit attempt for someone who, set their quit date a few days in the future. So we're helping them get ready, get rid of these tools that might act as a trigger or might make you tempted to go back to smoking. A support message, this one you get when you've been 3 days after your quit date. So you're 3 days smoke-free, so we're encouraging them, we're celebrating how far they've come already, and then we're letting them know, even though smoking reduces your sense of taste, even by being smoke-free for 2 days, your taste buds are starting to regrow. So you'll be able to taste more things in the future and enjoy that part of your success. And then for a fact-based message, this one is an example. It talks about how athletes and sports fans should know that quitting smoking can strengthen your lungs and help you speed up your recovery if you've had an injury. So it's kind of trying to reiterate some of the benefits of quitting through a fact. Here's examples of what we would send back for a keyword, like I mentioned, the 3 keywords. So if you text that you're craving to the text program, this is one of the messages you will get back. And there's a rotation of about 10 messages for each of these keywords. So we try to keep the content fresh for the user, regardless of how often they're sending the keywords. So for a craving message, one of the messages they get back will ask, do you have a common pattern or do you always feel the urge to smoke at the same time? Once you know your routine, you can change it and you can overcome that craving. If someone's in a bad mood, they can text the mood keyword and we say, hey, are you stressed today? Smoking is not the solution to your stress. Instead of smoking, write to a friend or call, have someone help you keep on track and stay successful. If you have a slip and you've smoked and you tell the program, here we try very hard not to be judgmental. So we say, slips happen, don't give up. Everything can, things are difficult and you can learn along the way. Start again and try again and you'll do better next time. So those are the kinds of responses we have for the keywords. So we have a little bit of user data that I want to share with you today. So this is looking at about 1 year of use in the text message program. So in 1 year, we had almost 550 people sign up for the program. The majority of people who sign up online. 55% of the users are male, and almost 90% are daily smokers. And these distributions are a little bit different than what we see in our general adult population. In our adult English-speaking population, we have about 70% of users who are actually female, so the majority are female, and we have a higher prevalence of daily smokers. So what we see in our Spanish-speaking program actually tracks pretty well with what we would expect from our knowledge of smoking in the Hispanic population. Most users who sign up set their quit date for the same day that they enroll, so unfortunately there aren't many people getting those preparation messages. And then for program completion, about 64% of users who sign up are still enrolled in the program by the end of the 6 weeks, which is actually really good because that number is lower for our English version of the program. So that is not even 60% of users. And the average days enrolled is 32 days for our Espanol text program. And so this is actually really encouraging. We feel like the users of our Spanish language program are more engaged than our English program users. So that is really encouraging news. And then at the end of the program, currently about 8% of people self-report that they're still abstinent at the end of the program. And this number also is a conservative estimate. We don't have great response rates to our questions when we ask people if they're still smoking. Not surprisingly, a lot of people don't like to answer that question. So this 8% we count anyone who didn't answer as still smoking. So we're trying to be pretty conservative in our smoking outcomes. So that is an overview of our text program. Now I want to talk a little bit about how we can maybe promote our resources or materials that you can use to promote the resources if you would like to do that. So unfortunately, because of budget restrictions, we haven't been able to promote our Spanish language resources on a large scale, which we would like. So we're really interested in working with others to increase our reach to this population. So if you're interested in materials, you can go to the link at the bottom of this slide, and it will take you to this specific page, which is a page designed for health professionals. And so this page has several different ways, some links that you can download for printed materials, and also some online buttons that you can incorporate into your website. So for printed materials, we have a two-sided flyer that you can download and print if you would like. So here's the first side of that flyer. So it talks about the espanol.smokefree.gov page, and then the back side talks about both the website and the text messaging program. So that's available to download on this webpage. And then we also have a couple one-page flyers. This one has a man. We have another one that also has a woman. So depending on what's more appropriate for your group, you could download and print this just how it is in color or in black and white. And then lastly, if you have online resources, this is what I was alluding to about the online buttons. This page comes with source code that you can put into a website or onto a blog that when you're done creates an image that's clickable. And if you click on the image, you'll go to our Spanish-speaking page. So just to summarize, Smoke-Free Espanol provides cessation support in real time to Spanish-speaking users, and an encouraging finding is that engagement is higher than our Smoke-Free Text English language program. We also know that not all Hispanic smokers necessarily want a Spanish language tool. So in our adult English-speaking program, we probably have Hispanic smokers who are using that program, but until very recently, we didn't collect race or ethnicity data among our users. We've actually just started to collect that data, so moving forward, we will be able to also know in our English-speaking resources how many of those users are Hispanic and what are their outcomes relative to the other groups. So moving forward, we'll have better information about the totality of the Hispanic smokers using our resources. You are welcome to go online and find print or online promotional materials that are available through smokefree.gov or the Spanish version espanol.smokefree.gov for more information and resources. And thank you very much for your time. And I think now I can take any questions if we have any.
Thank you so much, Dr. Wiseman. Really helpful to get a better sense of NCI Smoke-Free Espanol service. So yes, if there are any questions that anyone has for Dr. Wiseman, feel free to write out your question in the chat box or the question box in your webinar platform toolbar. And I'll give people just a second to type any questions in before we move on to the next part of our webinar. Okay, well, let's move ahead, and if you think of questions while I'm reviewing some other information, please feel free to jot your questions down and we'll answer them at the end. So today's webinar was originally meant to provide instruction on how individual organizations could design their own text messaging services through vendors like Mobile Commons or other mobile messaging software companies. But after looking further into this process and some of the existing text message interventions that already exist, we came to the conclusion that not only was it not practical to really expect others to invent their own campaigns, it wasn't necessary to reinvent the wheel, at least in the case of smoking cessation. As you see, or as you saw from Dr. Weissman's presentation, NCI's program is very robust, culturally proficient, obviously bilingual English and Spanish, and extremely important, free. So it's in full confidence that we can recommend that you take advantage of this service and promote it widely using the methods Dr. Weissman mentioned. You could, for example, tie this into your promotion or for upcoming smoking cessation events, like the Great American Smokeout that's taking place on November 16th this year. So with regard to the HPV vaccine, we didn't really find anything out there that really fit the bill for Hispanics. So we created a very simple series of text messages that anyone can promote and use. Our HPV vaccination series text message reminder service, it's a bit of a mouthful, but that allows parents to sign up in either English or Spanish, after which point they'll receive a total of 10 text messages over 7 months with reminders to schedule their child's first and second HPV vaccination dose or doses. These messages are spaced out 6 months between the reminders for the first and second doses according to clinical guidelines. And then at the end of the series, they have the option to re-enroll in case they weren't able to follow through on the process the first time around. And of course, aside from any fees related to cell phone plans for using text, this is also a free service. So to enroll in this particular reminder service, you simply text HPV for the English version or VPH for the Spanish version to 805-722, and an introductory text message is delivered explaining what the reminder service is about, which you see here. This is obviously the English version. And then the reminder text begin a day later, as you see here. So the first reminder says, first reminder to schedule the first HPV vaccine dose with your healthcare provider. Contact the toll-free Su Familia helpline for assistance. A follow-up to the first reminder comes 2 weeks later. In case you've forgotten, contact your healthcare provider now to make an appointment for your child's first HPV vaccine dose. Next dose reminder in 6 months. So that, of course, is followed by the reminder for the second dose 6 months later. It's been 6 months, time to schedule the HPV vaccine dose with your healthcare provider. And the helpline that's being referenced in these texts offers provider referrals to participants, and I'll review that service in just a little bit. So the text messages continue. We see here that, well, there's actually another follow-up reminder to the last text message, and then they'll receive this one, this congratulatory text message. Hopefully you've completed your child's HPV vaccine series or scheduled the second dose. Questions, call the helpline. And then it's followed by a reminder that if they weren't able to initiate the actual HPV vaccine series, they can re-enroll to start the process over again. In order to help you promote this service, you can go to our network website for a downloadable flyer that you see here for posting in your clinics or your waiting rooms, your community centers, to put in newsletters, etc. It gives an overview of what the service is about and instructions on how to opt in to receive the text messages. So please take advantage of that. As I mentioned earlier, we incorporate into these texts the National Alliance for Hispanic Health's toll-free bilingual Hispanic family helpline for assistance with locating low-cost, convenient, and culturally proficient healthcare providers and services that offer the HPV vaccination. Su Familia, or Your Family in English, is a toll-free bilingual helpline, 1-866-783-2645, which is, as I mentioned, operated by the Alliance, which is the parent organization of the Nuestras Voces network. Su Familia has been in operation for 15 years and has assisted 127,000 individuals. In a nutshell, Su Familia provides free, culturally appropriate, reliable, and confidential health information and materials in Spanish and English to help callers navigate the U.S. health system and stay healthy. The helpline database includes over 13,000 providers around the United States to connect callers with low-cost or sliding fee scale healthcare services in their community using a caller's zip code. The helpline also, just so you know, assists callers with the health insurance plan enrollment process through the marketplace, Medicaid, Medicare, and CHIP. And the helpline is staffed by bilingual health promotion advisors that include a medical doctor and nurse who provide basic health information on a wide range of health topics over the phone, as well as through material dissemination after the conclusion of each call. Helpline hours of service are 9 to 6 Eastern, Monday through Friday, and any calls after those hours are returned the following business day. The helpline uses a case management model to support callers with tailored assistance to meet their specific needs. It's important to note that there is no time limit to a call, which on average lasts between 10 to 15 minutes, but can run up to an hour or more depending on how complicated a caller's situation is. And that's not including time that it takes to do callbacks when additional research is needed to identify the most appropriate referrals for a caller. Referrals include not only culturally appropriate and sliding fee scale healthcare centers and health screening and vaccination locations, but also referrals to organizations that can assist with medical bills, specialty medical or surgical treatments, prescription assistance, and other social services to support basic needs. So anyone who has enrolled in the HPV vaccination reminder service can call the helpline to receive tailored assistance to locate a clinic that offers the HPV vaccine in their community. So that is the end of my presentation, and I think we have time now for some questions, and I see a few here. The first one is, can the parent respond to the text message that says, "I made the appointment"? At this point, we don't have that option, but it's something that we could add. Really what we are hoping that people will do, the call to action, is to contact the Su Familia helpline so that they can make sure that they locate an appropriate and convenient location to get the HPV vaccine for their child, and then answer any questions that may come up. So we'll see as we move forward how we can incorporate a way for participants to write back. Let's see. Is it acceptable, here's another question, to tie the text messages into DPH quit line TUPP text as one concerted program by region and or state, or do they need to be done as separate campaigns within our project programs? That's a good question. I'm not sure of the exact answer, to be honest. I mean, I think it's something we could certainly discuss and look into a way to sort of combine them. So that's from David. So David, if you would like to reach out to me after the webinar, I'd be happy to talk more with you about that. Can we receive copies of this presentation? Yes. So this recording of this webinar and the slides will be posted on our network website later this afternoon. So you'll just go to nuestrasvoces.org and you'll be able to download both of those. Are there any other questions? Okay. Well, hearing none, I think, uh-oh, wait, there are some more here. Thank you for your information about the helpline. Can you talk a little more about how they address commercial tobacco use, and do they refer callers to the state quit lines? Yes, our helpline advisors, promotion advisors, can provide information to callers and can counsel them on smoking and the dangers of smoking, including secondhand smoke. They also refer people to Déjalo Ya in cases the Spanish language quit line, or if they're English speakers, they'll refer them to 1-800-QUIT-NOW. But they do refer them to the quit lines if they are in need of specific services, and those would depend on what's available according to this their home state. So in that sense, they are connected back to their home state services. So the question is, once they have their first appointment, they still may need a reminder for the second and third appointments, especially since that is where the numbers drop off. Yeah, so that's actually, we have built that in, and maybe it wasn't clear from the way I described it, but they do receive a total of 4 reminders, 2 for the first dose and 2 for the second. So since the third dose is not required unless a child is over 14 years old, that's how we've designed this, so that they receive 4 total reminders for both the first and second dose. So this is a brand new system. The question is about what kind of evaluation are we planning for the HPV vaccine reminder system. So we're working with our evaluator right now to design an evaluation that can track and measure the effectiveness of this particular service. So we'll be sure to share those results as they're determined. Any other questions? These are good. Okay, there's another question. We're wondering if there are any docs or messaging to address any concerns people have on any downsides to the vaccine. David, yes, I mean, our helpline promotion advisors are very informed about a lot of the concerns around the HPV vaccine and vaccines in general. So when callers speak with one of our helpline promotion advisors, they know how to address those concerns and reassure them. However, if there's some particular documentation or guidelines that you think we should consider or have on hand as we receive these calls, we'd love to receive those from you. Any other questions? Okay, well, if any come up after we conclude here, please feel free to reach out to me directly. My email address is pbaker, B-A-K-E-R, at healthyamericas.org. I think my email address was also a part of the invitation for the webinar that you signed up for, the registration process. So you can reach me there. You can also reach me through our website, nuestrasvoces.org. We hope that you found today's presentation interesting and now have some more information on additional tools to use in your efforts to engage with local communities and reduce the burden of tobacco use and cancer. I want to thank again Dr. Wiseman for her presentation. And again, just a reminder that this webinar has been recorded and you'll be able to access this on our website shortly. So thank you again for joining us. Oh, and one final thing, please help us out. We have a short survey. It takes about 2 minutes that we'll send you by email this afternoon. Your feedback is really appreciated for these types of activities that we do to help us do a better job moving forward. So thank you again for your time today and hope everyone has a great weekend.